At AHLA, we have a long and deep commitment to diversity. We are committed to engaging with the challenges and solutions to healthcare disparities. We are guided by sharing facts and truths, and we support and foster an open forum where we all come together in a collaborative fashion. Daniel Dawes is a widely respected lawyer, author, scholar, educator, and leader in the health equity, health reform, and mental health movements. He brings a forward-thinking, inclusive, and multidisciplinary approach to health policy.
When you look at the policies, when you look at the laws in this country, and you put them in three buckets. So I define political determinants of health as basically a systematic process of 1, structuring relationships, 2, distributing resources, and 3, administering power. And they operate simultaneously in ways that mutually reinforce or influence one another to advance health equity or to hinder health equity. More likely, what we have seen in this country is that most of the time, the political determinants of health have actually led to creating, perpetuating, and exacerbating racial and ethnic health inequities, as well as inequities plaguing other marginalized groups, LGBTQ+, people with disabilities, etc.
And do you see us coming together to solve that? Or are we going to be a society that continues to look at these issues through that narrow healthcare lens and not recognize that it's a larger complex issue and bring the relevant parties to the table?
Well, I will say, kudos to the American Health Law Association, right? And to our leaders here in this country who are now recognizing the impact that these multiple interacting determinants of health have on the health outcomes that we see further downstream. You are absolutely right. It's not just healthcare. It's climate change. It's all of the above, right? And thankfully, I believe we have leaders today who understand this, appreciate the impact that it's having. They can see it now in real time during this quadruple pandemic that we are living in with COVID-19, this racial and social reckoning, the mental health crisis, this economic crisis. And now because of this period, folks are waking up.
As we are getting out of the COVID cloud,
yes,
and people are hungering to get back to normal, are we going to forget what we learned and experienced through COVID, and then the window for change shrinks? Or do you think that it's been ignited and we will see the change that you want? So where do you see us in 10 years?
So I am hoping that this is not just a moment, but it is a sustained movement going forward.
Racial disparities in healthcare are an urgent issue, and AHLA is at the forefront of providing education to those involved in health law that impacts this area. Visit our website to discover more.